We honor Dr. Rebecca Shadowen. Dr. Shadowen was known as a nationally recognized infectious disease specialist and epidemiologist. She was a researcher, a teacher, a wife, and a mother. Rebecca Dawn Hunt, Becky to friends and family, came to WKU in the fall of 1976. She graduated with honors in 1980 alongside her boyfriend, David. The two married after their first year at the University of Louisville Medical School and continued their education in Kansas City, Charleston, before coming back to Bowling Green to begin their practices. Dr. Shadowen displayed her passion for educating the community from the beginning, whether it was setting up HIV care, preparing travel medicine for missionaries overseas, or researching the coronavirus, well before any of us heard the word COVID. Dr. Shadowen served on the Bowling Green, Warren County Coronavirus Task Force and became an early advocate for wearing masks to prevent the spread of the virus. And she knew that a vaccine would eventually serve as our best line of protection. In May of 2020, Dr. Shadowen tested positive for COVID-19, succumbing to the illness 4 months later, long before that vaccine became available. Her death left a hole in the medical community, the Bowling Green community, the WKU family, and her family. Dr. Shadowen's love of medicine was well documented. But what you may not know is she also loved music. In fact, when she arrived at WKU as a student, she faced a decision. Would she pursue a medical career as a pre-med major, or would she follow her interest in music as a fine arts major? I think we can all agree she made the right choice. Now please turn your attention to the video screen and meet our final 2021 Hall of Distinguished Alumni inductee, Dr. Rebecca Shadowen, whose award will be received by her husband, David.
Now more than ever, I think that knowledge is empowerment. And if we keep giving ourselves the information that we need to be able to function reasonably and to protect ourselves, then you feel like you have some degree of safety.
Throughout her medical career, the late Dr. Rebecca Shadowen did not shy away from any opportunity to share important health information.
She was often the one the hospital went to say, would you please talk about this particular problem, this particular thing? And she was very willing to do that and very glad to do that and stayed really caught up in all the things in that area.
A global thinker who valued her community very much, Dr. Shadowen's voice was listened to carefully by people around the state, especially during the COVID-19 pandemic.
But her expertise was just so different, and her ability to be able to share the information that she read. She was always just the best teacher. And she would teach us and explain it in such a way that we could use it and do something with it.
Sadly, her voice was silenced when she succumbed to the coronavirus on September 11, 2020, 4 months after being diagnosed.
She had signal to be on a ventilator. She knew that really raised your chances of dying and not doing well. So when we transferred to UK, she knew that the odds were against her.
Rebecca Shadowen's death at the age of 62 made national news, her obituary in the New York Times. The infectious disease specialist who helped navigate HIV, SARS, and diagnose this area's first case of Lyme disease had died from COVID-19, a virus she had been researching relentlessly since January of 2020.
She was a strong proponent for masks and social distancing and all that thing early on. And even back in the early days, she was one of the ones saying that if we ever get a vaccine, this is how we'll fix this. We won't fix this with nothing short of that, basically.
Born Rebecca Dawn Hunt on April 4, 1958 in Louisville, Becky, as she was known to friends and family, grew up in nearby Bullitt County. In high school, she was involved in band, speech, and played the lead role in My Fair Lady. She was co-valedictorian of her class at Bullitt Central High School. Medicine was part of her life from an early age.
Starting about age 15, she started working in the medical office where her mother worked. There was a family practice office, so she got a little bit of taste of medicine there. She actually got to do quite a bit. While she was there in her high school years, she learned how to draw blood and how to take x-rays and how to room patients and quite a few things.
Enrolling at WKU in the fall of 1976, Becky's classes often overlapped with another pre-med student named David Shadowen. He remembers coming to her rescue when another classmate offered Becky a ride down the hill after class.
And I could tell from the look on her face, she didn't really want to ride with him. So I said, well, she's not going to ride with you because she already said she's going to ride down the hill with me. And when he walked away, she looked relieved. I said, yeah, that was a good choice. He's not the nicest of guys, but there's something I should tell you. I don't own a car.
Their comparative anatomy professor, Dr. Blaine Farrell, remembers the courtship well.
But Becky and David were in the course together, and I knew they were probably going to get married because they sat in the far back left corner in the lab and were dissecting, and I couldn't tell whose hand was which because they were all intertwined all the time.
After graduating from WKU with honors in 1980, David and Becky went on to U of L Medical School.
I was just there on a clinical track. I was just there to learn how to be a doctor, and that was that. On the other hand, she was there for everything. She wanted to do research, she wanted to do teaching, she wanted to take care of patients, and that's the way her training went.
They married after their first year. Becky went on to specialize in infectious disease and David in endocrinology. A residency followed at the University of Missouri at Kansas City, and she studied infectious disease at the Medical University of South Carolina in Charleston. It was 1989 before the couple settled back in Bowling Green to start practicing medicine and eventually start a family.
And we didn't have our children till late. We were in our late 30s when we had our kids. You know, she had twins. I just wanted them, but she had twins. And then she was a primary caregiver. She fed them, she took them to school, she did the homework with them, all the things that kids need. Fortunately, she did for them.
Even with a demanding career, her longtime colleague and neighbor, Melinda Joyce, says being a mom was the job she cherished the most.
She was very seamless, moving between what was going on at the hospital, what was going on in her practice, but also being able to be first and foremost mom. I still wonder to this day when she ever slept, because it didn't matter. You would get emails from her at 2 in the morning, and then at 2 in the afternoon, she would be in the yard playing with her children.
The family loved to travel together. Becky was also committed to helping people get the proper vaccines and medications to do mission work all over the world. Working almost to the end from her hospital bed in the COVID unit she helped develop at the medical center, Dr. Shadowen was hopeful for the day a COVID-19 vaccine would be available.
When she was in the hospital, she was telling me and the kids, as soon as you have the opportunity, you have to get this.
I was with her on the last day of her life. David allowed me to be there, so I was there with the kids, and then I left before she passed away. And that was a very, very hard day.
Ultimately, all she wanted to do was help people.
That's why she went into medicine, but she went even a step higher than most people, and she worked very hard. And she gained a great reputation, but was never arrogant. She was very humble. She was just a wonderful person.
And she had a wonderful sense of humor. She had the best laugh in the world. I mean, you know, it was, she enjoyed life. She enjoyed what she did.
As with her other numerous accolades she received throughout her career, friends and family say Dr. Shadowen would have been truly humbled and honored by her induction into the Hall of Distinguished Alumni.
The spirit makes the master. I think that's just perfect for her. As far as being inducted into the Hall of Fame, she would be very honored, but she would say, but there are so many other people that should do this. What about so-and-so? Or what about this person?
Still, her husband says it's hard to overstate the impact WKU had on her entire life.
She used her education, her background, to become the best doctor, the best parent, the best mother that she could. So it wasn't just the medical things that Western taught her. It taught her how to be a good friend, how to be a good spouse, and she used all that.
2021 Hall of Distinguished Alumni inductee, Dr. Rebecca Shadowen.
I would like to thank Western Kentucky University for awarding this award to my wife, Dr. Rebecca Shadowen. She would have been very pleased and honored to have received this award. She was encouraged to attend Western by one of her high school teachers. When she decided to go between music and pre-med, unfortunately for me, she chose pre-med because they put her in a lot of classes together with me. She graduated with honors in 1984 and learned three main things at Western. The first was continue to learn and educate herself the rest of her life. She did attend medical school at Louisville and in Kansas City for internal medicine and Charleston, South Carolina for infectious disease. But after that, she continued to take education seriously, and she attended national meetings regularly, going to educational luncheons, doing online computer courses, and staying up to date in her field by reading medical journals. The second thing she learned from Western was continue doing research. She did research at Western on mice in the biology department, and then while in South Carolina, she did research developing a monoclonal antibody test for Campylobacter pylori and participated in new drug research to treat cytomegaloviruses and fungal infections. When we moved back to Bowling Green, she began her clinical practice but continued to do research here, evaluating new drugs and treatments for AIDS, fungal infections, viral infections, including hepatitis C and cytomegalovirus. She also worked on gram-positive infections and gram-negative sepsis. She also did research in how to appropriately use antibiotics to avoid development of resistance and how to get physicians to use antibiotics appropriately. She had many people help her with these research projects, including her professors at Western and South Carolina, and many people here in Bowling Green. In particular, Dr. Melinda Joyce and her worked jointly on several research projects while she was here. The third thing she took from Western was to continue to try and treat others. She gave lectures to children at McNeil Elementary School, Bowling Green Junior High. She gave lectures to the WKU Gifted Students Program, the WKU Biology Honor Society, and then helped teach basic medical skills to medical students here in Bowling Green. She taught the local doctors and nurses by giving grand rounds at the medical center and doing noon conferences and medical meetings at local hospitals, and including hospitals here in town, Glasgow, Franklin, Scottsville, Hawkinsville, Evansville. And she also gave lectures at the Warren County Medical Society and Barron County Medical Society. She published articles in national journals for infectious disease. She presented research at national meetings for infectious disease doctors and also for GI doctors. She wrote articles about antiretroviral therapy that were published in the Kentucky Pharmacy Journal and helped teach medical students and residents how to do basic medical care of patients. In our area, she also helped develop the outpatient IV antibiotic treatment program for patients and also helped develop the field of travel medicine, which allowed for safer international travel for missionaries and other folks who were doing worldwide travel from our region. When the COVID virus hit, she helped develop and work with the Bowling Green and Warren County Coronavirus Work Group and with Drs. Randy Carter and William Moss set up the COVID unit at Med Center, which I think helped contribute to how what we did here locally with the disease. She participated in statewide Zoom meetings sponsored by Governor Andy Beshear and Dr. Stack, the medical director for the Kentucky Department of Public Health. And I think their efforts helped control COVID-19 in our state such that it kept Kentucky's rate of hospitalizations and deaths lower than every state that touched our state for over a year. However, I think the best teaching she did here in Bowling Green occurred when she would talk one-on-one with either nurses or doctors or patients about how to treat various medical problems. This is where Becky always thought she did her most effective teaching, and I would have to agree with that. Western is where she was taught in the background of lifelong learning, doing research, and teaching others. She was particularly grateful to the professors in her pre-med classes for their patience and help in teaching her these skills. I'd like to thank the Alumni Association for having these awards to honor deserving graduates, and in particular, I'd like to thank Jenny Hensley for her help guiding my children and me through this process. I'd also like to thank President Timothy Caboni for continuing this tradition of having distinguished alumni awards. because our school does produce many graduates who have made significant contributions in many fields at the local, national, and international levels. And they do deserve to be recognized for what they've done and achieved. Lastly, I'd like to thank my wife for putting up with me for 40 years, raising and taking care of our children. You don't always realize what someone does for you to the call. I'd like to thank my family and friends who helped get me and my children through this process of losing her. And if she was here, I'm sure she would end this speech by saying something about doing what you could to protect yourself. We have not yet reached herd immunity in our area, this state, nor in the state at all. And she would encourage everyone to wear a mask indoors and do social distancing, and when able, get a vaccine and get a booster. We have lost more than 734,000 people in this country to COVID, the majority of which have died this year, not last year. In Kentucky, we lost 9,600 people to COVID. That's more than the population of Franklin, Kentucky. And the last thing my wife wrote was, protect yourself and others. Currently, getting a vaccine and wearing a mask indoors is the best way to do that. Thank you all very much.